Vitamin D. This is a nutrient multimedia presentation for APN 615 Nutrition and Metabolism. My name is Lauren Sullivan and I am your tour guide. Our vitamin D tour today will include an overview of 5 topics about vitamin D. To have a good understanding of this vitamin, you must know the sources of vitamin D, the functions of vitamin D, how obesity changes the usefulness of vitamin D, that many patients with obesity choose weight loss surgery, and our final tour will talk about patients who select weight loss surgery and how they utilize vitamin D. The best sources of vitamin D is ultraviolet radiation from the sun. Vitamin D supplements may also provide additional vitamin D. Vitamin D needs your body fat to absorb. But too many vitamins from supplements can cause an overload in the body and make you sick and lead to complications. The liver and the kidneys will store inactive vitamin D, and the liver converts it to useful active vitamin D called ergocalciferol or calcidiol, and the kidneys form calcitriol, also known as cholecalciferol. Vitamin D also comes from food sources including milk, cheese, peas and beans, egg yolks, fatty fish and liver, shiitake mushrooms, and butter. We are at our second stop, and vitamin D functions everywhere in the body. Not enough vitamin D may cause problems with your muscles, how you fight disease, your blood pressure, cancer cell growth, but the main function of vitamin D is bone health, and the goal, of course, is for strong bone development. Vitamin D deficiency occurs for many reasons, including low consumption of D-rich foods, surgery changes, kidney problems, where you live, age, and obesity. Well, how does obesity change the way vitamin D is used? Did you know 37% of adults in the United States have obesity, more women than men, and patients with obesity have a 35% higher vitamin D deficiency than healthy weight persons? Vitamin D is fat soluble, so persons with obesity have more and larger fat cells. Vitamin D gets stuck in the fat cells and can't be used. So weight loss surgery is our tour stop number 4. The ASMBS reports 1 million Americans had weight loss surgery from 2013 to 2017, and bypass surgery does a bit of replumbing on the intestines, making it harder for vitamin D and phosphorus and calcium to absorb. This causes a decrease in calcium and vitamin D and a decrease in bone strength and an increase in bone fractures. So a brilliant idea was crafted. If gastric bypass patients were given enough vitamin D, it might stop the vitamin D deficiency and stop the fractures, broken bones. But what is the right amount? Is the right amount 3,000 international units, 5,000 international units, or 6,000 international units per day? Well, that's the question of the day, and a little bit of research may give us the answer. Thanks for taking this tour with me, and here are my references.